I'm Adrian Bauman from Sydney University in Australia, and I'm also affiliated with WIT. I teach in public health and have been doing so for a long time. I do research in chronic disease prevention, in physical activity in particular, but broadly in NCD policy, interventions, surveillance, and other areas of public health.
Great, Adrian. My students regularly read some of your work, your policy work. If I had to ask you, from all the work that you've done, what do you reckon has had the greatest impact on policy?
It's difficult to impact on policy unless you do a wonderful intervention at the population level, in other words, at scale, because many of the small interventions we do are actually only internally valid. They're only relevant to the people who enrolled in the trials or in the studies. So the work I'm most proud of is work at the population level, community-wide interventions, and we've done several, particularly for physical activity in Australia, in Canada, and in West Virginia in the USA. Whole community interventions where we're trying to reach everyone in the population to get them to become more active. Those are policy informing because if they work, they can be taken up by government, taken up by policy makers, and disseminated across a country or a region quite easily.
And if there was one thing or two things you could do to improve the health of populations worldwide, what would it be?
To improve population health worldwide, you'd have to really improve water quality and sanitation as the key thing that's going to have the greatest impact on low-income countries, on risk of diarrheal disease, infant mortality, and maternal mortality. If you had to do one more thing, it would probably be to reduce smoking across the world because it's the single preventable risk factor for chronic disease prevention. The area I work in, physical inactivity, would probably come next for chronic disease prevention because a third of adults worldwide are not even meeting the minimum recommendation for physical activity guidelines, and 3/4 of teenagers and adolescents aren't meeting the hour a day recommended for them. So really we've got a very inactive population, and that would be the next thing that I would do, is how can we make populations more active?
Thanks, Adrian.